Hey, what's up guys? Dr. Kyle Loveless here. I'm gonna shoot a video today for you guys on pain. It's one of the most common health issues in our world today, whether it's back pain, whether it's neck pain. I'm talking about the kind of systemic spinal pains, the knee pains, the arthritis, all those kind of things today. And I wanna give you the 5 things that I think everyone, if you start to make these 5 changes, it's at least gonna move you in the right direction. It might not be the full answer, but it's definitely gonna move you in the right direction, and they're changes that you should make, okay? So stay tuned for that. Also, if you wanna get our ebook, go to the area below and we'll have that for you posted so you can get that for free. And then finally, like this channel, subscribe so that you can get all the videos that we're constantly putting out for you and learn more so you can become your own health expert. All right, guys, let's talk about pain. Let's talk about all the different things that can cause pain, but more importantly, what can you actually do about it? If you're someone, well, first of all, if you're listening to this video, I can tell you, you're someone that's had pain before, you know someone that's had pain, and you wanna get rid of it. Like, it's affecting your life enough to actually watch a video about it and spend the next 5 minutes with me learning about that. Now, what makes me someone that you should listen to? Well, I've been in practice for 12 years taking care of people's pain. Daily basis, I have people, I'd say per day, about 100 people per day, coming to me in some sort of a pain that I have to help them get rid of, and they pay me money to help them get rid of that pain. And it's something I'm very good at, and I've gotten tons of great results with, whether it's back pain, whether it's neck pain, whether it's headaches. It's something I truly understand, okay? So I've got a lot of experience in this background. It's also as my overall education, formal education is as a chiropractor. So my undergrad was in sports medicine, which is all about keeping people out of pain and functioning at a high level. And then my graduate degree is in chiropractic and all the studying I've done over the year in this process, okay? So number one thing I'll tell you that you should do if you have back pain, neck pain, or even just joint pain in general, number one thing I'll tell you to do, and this might seem like it's a lot of work, I actually have to go somewhere to do it, but it's the one thing that we've done over the years out of all these things that's helped people the most, and that's get a good chiropractor. Get chiropractic care. I'm telling you, it's not just about pain with chiropractic, but it will help you get rid of your pain. And then it's gonna help make the rest of your life better. You're gonna be sleeping better, you're gonna be digesting food better, you're gonna experience those things. A lot of times your allergies will go away with chiropractic care. You want a good spinal corrective chiropractor, so find one in your area. If you're searching and you can't find one, send us a message and we'll help you find one in your area. If you live in Charlotte, come to Queen City Health Center and in the Matthews area, and we'll get you connected there. If you're farther away in Charlotte, we have friends and other chiropractors all over the town. But chiropractic care, I'm telling you, is huge. Getting your spine moving. And the reason it's so important, chiropractic care, is because the reason we're in pain in the first place is there's a dysfunction in the joint, which has led to, and many times caused, a dysfunction in the muscle. Well, chiropractic care goes in and we help get that joint moving again. We help align everything. We get the full functioning back in the joint. And we help work on the musculature to remove any trigger points or scar tissue and help retrain the body so that it actually lasts for you. So it's not just a quick fix, right? We're not giving you an ibuprofen or a pill that's gonna make you feel a little bit better for the day and destroy your gut. We're gonna give you something that's actually gonna help your body. I'm sorry, it's gonna heal you. It's gonna help your body heal itself. All right, so that's number one, chiropractic care. Number 2, here's 3 things that I'm gonna recommend taking for anybody that's in pain starting off. Take turmeric. Okay, turmeric is a good, strong, non-invasive, but non-chemical anti-inflammatory. It has the same concept as an ibuprofen or some sort of NSAID. It's a COX-2 inhibitor, so it works really good to help control inflammation in your body, not manipulate the body like medications, but control it. And then fish oil is awesome as well in that a lot of our inflammation in our body comes from having too high of an omega-6 count of fats. Our American diet is about a 20-to-1 ratio of omega-6 to omega-3 fats. However, a healthy diet, our cell walls are surrounded by fats, and a healthy diet and a healthy fat ratio is more of a 3-to-1, 4-to-1 ratio of omega-6 to omega-3 fats. So by taking more omega-3 fats that you find in this fish oil, it helps you at a cellular level and reduces the inflammation in your body. And again, it's all about reducing that constant inflammatory response. That's some of the effect in terms of what you can do and take. And then the final thing I was gonna say to take is CBD oil. CBD oil is amazing, not necessarily just as much as reducing inflammation, though it can do that too, but it's an adaptogen and it helps your body handle stress. It also is really good for helping with pain. So a good CBD oil, fish oil, and turmeric are great. Okay, next step. What's the third thing you need to do? Well, changing your diet can play a huge role in it. I know that's really hard to grasp, is how does what am I eating causing my knee pain or my back pain? Well, I'll tell you this, playing soccer my whole life, or not, I guess I'm almost 40 now, so I haven't played soccer in 10 years, so I guess I can't say I've played soccer my whole life anymore. But when I was young, I played soccer. I'm still young, man. It just isn't working out for me. All right. Anyways, I played soccer until I was about 25 years old, and from when I was a kid. And when I quit playing soccer, my knees were killing me. I had knee pain all the time, walking up the stairs, and it just all the time hurting. And I was eating a really junky diet. I'd eat a lot of pasta, a lot of rice, a lot of bread, a lot of gluten. I would eat just conventional meats, and I would eat pretty much whatever I wanted to a level. I didn't do too extreme, but I would eat just the normal sad American diet. And what would happen is I'd always be in pain. And so I started reading about nutrition as I was going through chiropractic school and learning. I started reading about nutrition, and I found that those foods actually create inflammation in my body and can make me sick. And that's why I was tired all the time. So I changed my diet. And as I changed my diet, I was getting adjusted, but I was still having some of these knee pains. And so I added to that process of getting adjusted by changing my diet. I took out grains. I took out pasta, rice, breads, all those major sugars and refined sugars. I reduced those and took most of those out. I added good fats into my diet. Okay, I took out conventional meat and started adding grass-fed, free-range, organic meats, the way meat was supposed to be raised. And I started eating a really clean, non-inflammatory diet. I'll tell you, within 3 or 4 months, my knee pain was gone, and I've never had knee pain again. In terms of like chronic knee pain, I bumped my knee and it hurts, but I haven't had knee pain since then because of changing my diet. And that's all the difference I did to get rid of that knee pain. I didn't take a bunch of supplements. I just changed my diet. So if you're in pain, to reduce inflammation in your body, when our body is systemically inflamed, our most problematic area is what we're going to feel it in. So if you've had a lot of stress in your knees over the years, or maybe you have breakdown in the knee joint, if your body's systemically inflamed, you're going to have knee pain. But if you reduce that systemic inflammation, there's a good possibility you might not have knee pain. And just so you guys know, I just popped in my head, pain is not genetic. Your knee problem is not genetic. Your back problem is not genetic. It doesn't even make sense. It doesn't line up, because then every joint in your back would be deteriorated the same. Every knee would be deteriorated the same. They're not genetic issues. They're things you can be more susceptible to, but don't blame it on your parents. It's you. It's your lifestyle that has created it, whether it's an injury or what you're doing daily. Next one is sleep. Recovery is huge for pain, right? If you go to the gym and you work out and you never give your body and muscles a break, you just keep working out, keep working out, keep working out, they're never going to heal and recover and get stronger. Well, that goes with everything in our body. So getting 7 to 9 hours of sleep every night is something you cannot replace. If you want to feel uninflamed and not in pain, you got to get enough sleep. Final thing is movement. This one's big, because and also honestly, chiropractic care is what helps so much with people sitting all the time, as we get the joints moving in the spine. But 90% of the stimulation to our brain comes from our spine moving. So if we're like this all day long in this awkward position with our head way out here and all the weight of our head's going into the lower neck and all the weight of our upper back's going into our lower back, and we're just hunched over and our pecs are really tight and our shoulders are rotated and we're just stretching these muscles all the time, well, yeah, you're gonna have pain, right? You don't move a joint, it stops moving. It locks up and causes pain. That's why when you have shoulder surgery or knee surgery, the very first thing they want to do to that joint is what? Get it moving. They used to just do this, but then they found that actually deteriorated the joint more. Movement is the key to life. 90% of the stimulation to your brain. Remember that. Your brain controls everything. So if you want to feel good, have energy, and not be in pain, you got to move. So one of the things you can do is if you have a sitting job, because I've had people say, well, I can't, I got to sit all day long because I'm on a computer. Get yourself a wobble cushion, get you something you can move on, an exercise ball, something you can work. And look, I mean, just like this, get full range of motion into your spine, get up and stretch, go out for a walk when you get a chance throughout the day. But we should be moving all day long, not 15, 30 minutes of exercise all day long, right? We did a podcast a while back with our personal trainer, David Lohman, and one of the first things he said is, I'm not a fan of exercise being something you just have a moment of exercise in your day. It should be all day long. So movement is huge for getting rid of pain. Now, if you move and it hurts too much, well, that's why you need to go to a chiropractor so we can get your joints moving and functioning again so you can move all day long and prevent that pain. So, number 1, chiropractic care. Number 2, fish oil, turmeric, and CBD oil. Number 3, diet. My hands aren't even working right. Number 3, diet. Number 4, sleep and recover. And then finally, movement. Guys, if you do those 5 things, I hope and I really think it's going to get rid of your back pain. I don't like when people say it's absolutely going to. I guarantee it, because I'm not God. But those are significant things that could change that. However, one thing I will tell you, you will be healthier because of it. It's definitely not going to make you worse, okay? So do those things because it's what's best for you and best for your life. And the side effect is it's going to help you reduce pain in your life. All right, you guys have an awesome day. Make sure you like this channel, share this, and yeah, we'll talk to you next time.